Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again for another segment. In this segment, going to be speaking with Kaveh Safavi. He's joining us here from Accenture to talk about a new report called Digital Health Technology Vision 2020. Thank you so much.
Hey, Neil. Good to be here. Thanks for having me.
Give our listeners a bit of your background and talk about your role there at Accenture.
Sure. I lead our global practice, so I get to work with our payers and providers and government clients in about 24 geographies. I'm a doctor by original training, and I've had operating experiences both in the delivery system, doctors and hospital settings, as well as insurance. And I've also been involved with information products and technology products before I got into the work I do now around advising all of these entities. So I have a large experience base in digital health, as well as innovation and adoption of a variety of technologies. And I'm a co-author, along with Brian Callis, of this technology vision, which is something that Accenture builds out across all industries every year as a broad technology vision. And then we set out to try to take the concepts and explain them in the context of healthcare, which is our health technology vision for 2020.
That report is Digital Health Technology Vision 2020. Let's talk about some of the key findings.
This report is built on the shoulders of the last several years. Mm-hmm. And if you look back at those reports, one of the things that you'll find is actually 2 years ago, we described the concept of the post-digital era. And we made the statement that we've actually moved into a post-digital era, whereas thinking about digital technology as a discrete thing on the side really didn't make sense, because it's a fundamental capability. And when we first said that in 2018, a lot of healthcare people laughed because they said, you know, you're post-digital, we're pre-digital, you're not really talking about us. But the truth of the matter is that digital technologies are becoming quite ubiquitous. And we don't mean just general information technology, we mean a number of different advanced technologies. The real point of this is the recognition that technology has become so inextricably interwoven into businesses that it is now fundamentally not just part of a transaction, it's part of the human experience. In fact, one of our global survey, when we looked at just healthcare executives, 85% of healthcare executives acknowledge that technology has become an inextricable part of the human experience. So you really can't think about where one ends, where a physical ends and where a digital begins. And it is in that context that we wrote this year's report. And the central thesis, there are different elements to it, but the central thesis is that because it is part of the human experience, it really needs to be created from the perspective of the life of a patient or a citizen, including giving them the ability to control the technology. So actually people want to experience healthcare on their own terms. Technology allows them to do it, but it has to be built for them so they have that level of control. And then we go into a few different elements of what that means.
You know, just recently in the last 20 years, we've started to hear about patients and patients advocates touting, you know, take control of your healthcare, be more involved with in your healthcare. This COVID-19 pandemic, of course, technology is being embraced at a record pace. What do you say to those who are trying to, I guess, digest this huge transition when they were just getting used to being comfortable starting certain conversations with their healthcare providers?
Yeah, it's a fabulous question. So a few things. One is, when you're right, I mean, our basic message to our citizens was you're responsible for your own healthcare. It's not done to you. So that's the mindset that you described. And then technology is really a means to an end, right? It can be used. With or without that mindset. But if you accept the mindset that citizens are responsible for their own health, then technology is a tool for them to accomplish that end. And if it's going to be a useful tool to accomplish that end, it has to be built for them on their own terms. And COVID, in some ways, simply just amplifies. So the last 6 months has really amplified a few things. It's amplified the fact that for your safety from an infection perspective, it's probably better for healthcare to be done at a distance, especially during times of pandemic. So instead of our original model, which was two humans in the same room having an interaction, now we're basically saying if it's possible for two people to not be in the same room and have an interaction, it's probably safer. And we used to think about things like distance largely as a convenience issue, but now it's actually become a safety issue. And that's going to be embedded into into the way healthcare works. And that is going to require a technology scaffolding to accomplish that. We've also sped up the cycle of innovation as part of the discovery of the understanding the disease and treatments, and soon to be the dissemination of the vaccine. And all of those things are driven by digital technologies. They wouldn't have happened without digital technologies as part of them. And so you see a lot of that. And the last big thing that you see happening is that people are changing their attitudes towards work. They're changing their attitudes toward whether or not they're in a healthy situation. And healthcare is changing, and businesses are changing the way they respond in an environment where you can't get supplies because they're separated because of a pandemic and you have no access to them. And all of these things are forcing people to reconsider the way they live. And the net effect of it is everything that existed before COVID continues to exist, but the imperative is faster, and it's more digitally enabled.
Do you think that this embracing of technology on both the patient end and the provider end is going to, I guess, create any obstacles as, I guess, for lack of a better term, patients become smarter, more aware of their healthcare needs, their healthcare options? Will it tie the hands of some physicians as they try to do what they do more efficiently and navigate what the patient maybe thinks they know?
Yeah. Not necessarily. I understand exactly where your question is coming from. Let me actually share with you some data that we're about to release. Also, we do a digital consumer survey of healthcare attitudes. So this is, as opposed to the trends, this is the citizens' attitudes toward healthcare. And we actually did the survey before COVID. We were about to release it. We did a pre-release during COVID, and then because of COVID, we pulled it back and to try to recharacterize it. But what it basically shows is that the adoption of digital technologies broadly by consumers and citizens in the U.S. had reached a plateau over the last 2 years. We've been looking at adoption every 2 years for 4 consecutive groups of 2, and we found it had plateaued in the last 2 years. And the 3 biggest reasons it had plateaued were if you have a bad digital experience, you don't go back and use it. Second reason is that it's not being recommended by the delivery system, by doctors, because it doesn't fit in their workflow. And if your doctor doesn't recommend it, you don't use it. And the third is a concern over who has my information, privacy and security. And what COVID did was actually address that second one, because doctors were forced to use it because it was the only way to be able to take care of patients. 50% of all visits in May were done virtually because the offices were not open yet. And the net effect of that is that doctors got used to insinuating it in the workflow, and we think that creates adoption. It doesn't solve the problem of a bad digital experience. So one of the things that's imperative around the use of digital technologies is that it just has to work from an experience perspective. And if it doesn't work from an experience perspective from the patients, it's not going to be adopted. And then this issue of who has my data is pretty important, because a lot of people are fine if doctors have their data to take care of them, but they're really worried that the technology companies and the intermediaries who make these digital technologies available, they don't want them to have their data because they think they're going to use it for things like selling stuff to them or discriminating against them. And so their skepticism about digital is actually coming more from the issue of who owns the data. There used to be a concern doctors had that patients were going to essentially they would know too much and would create too much of a disruption or they would ask unnecessary questions or try to treat themselves in a way that was inappropriate. But I think we've had enough experience to show that that's actually not a problem. And you look at published data, for example, on open notes where doctors and patients see their data at the same time. As soon as it's created, they're both basically looking at the same data together. They're not looking at data the doctor wants them to see. They're seeing the same exact thing the doctors are seeing. And the evidence there suggests that any concern people had that it was going to make patients make bad decisions was alleviated, and the benefit of an empowered patient was greater than any harm that could come to the patient by getting information they couldn't deal with. So I think we've moved past that, but these issues of experience are pretty critical. We do pick up that concept in our first trend, which is the I in experience. And basically what we're saying is that if a digital technology is built to help a patient and it's designed, it needs to be customized by the patient, not to the patient. We call that concept this sort of mass customization approach. So it basically suggests that in the old days are until now, customization meant I would get data about you, and then I would customize your digital experience to reflect what I think you want based on information that I got about you. But that might, in fact, not be what you want. You might want it to be customized in a different way, and you want to have controls over that lever. And if I want you to use it, I actually need to let you drive the customization as opposed to just being imposed through some kind of black box from the outside. So that's where we get into this issue of really built around the person themselves as opposed to for the person.
Well, Kaveh, it's been great talking with you this evening. I'd like to give our listeners a website where we can learn more about Accenture and possibly get a link to Digital Health Technology Vision 2020 as well.
Accenture.com, and if you type in the 2020 Digital or Health Technology Vision, you will find it right away.
Well, Kaveh, I appreciate it once again. Thank you so much for joining us here on Health Professional Radio.
You're welcome, Neil. Good to talk to you. Take care.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.